Desiree here. So, in case you didn't know, I'm an addiction counselor, and a lot of people don't seem to understand what it is that we do as addiction counselors. We are counselors, but we specialize in treating addictions, and it can be specific addictions. Some people specifically do alcohol and drug treatment. Some people do gambling. Some people do any number of process or behavioral addictions, whatever. But this is the only profession that I've ever been in where it is so misunderstood what we actually do. And I worked in a restaurant for like 15 years. And when I worked in a restaurant, I never had a friend or a family member say, you know what, Desiree, I don't want you to cook for me. Don't cook for me. They would actually ask me to cook for them. And when I worked for a law firm, I never had anybody say, no, Desiree, I don't want any legal help. But let me have a conversation with somebody as a counselor. And it's, I don't want to talk about this, complete shutdown, get me off the couch, Desiree. And it is absolutely mind-blowing that I went through all the training and the education and the years of experience in helping people to work through their own problems. And yet they don't want that service for free. And even the companies that I've worked for, where they have, quality control and things of that nature, even the quality control team doesn't understand what it is that we do. I did a group note for a client where we talked about boundaries and communication. And the quality control team came back and said, oh, we're not going to accept this because it doesn't read like an addiction counselor. Okay, so I had to sit down and explain to someone who works in this field that communication is a big piece of addiction treatment. Boundary setting is a big piece of addiction treatment, and how would you not use your common sense to understand why that would be important? But the point is, a lot of people just don't understand what it is that we do. I'm not there to fix my clients. It's not my role to tell my clients what to do. I am the midwife, so to speak. I'm not there to have the baby. I'm there to help the other person have their baby. I'm there to help the other person to work through their problems. I'm not the smartest person in the world. I have my own issues. I can't tell you what to do, but you already have the answers for your problem. You just need to dig down deep within yourself and figure out what those answers are. And that's what a counselor helps you to do. To recognize any inconsistencies in your statements, to help you, to ask you questions that you answer on your own. The counselor doesn't answer those questions for you. You answer those questions for you. And then ultimately, at the end of the day, you figure out what it is that you want to do with your life and what your own issues really are. Because sometimes we don't even know what the real issue is. And counselors have been taught skills and techniques to help you help yourself. That's all a counselor does. You don't have to be completely mentally ill to go to a counselor. In fact, we actually call people who are not mentally ill and go to counselors the worried well. They're just worried about issues and they want to get better. They want to figure out their problem and they're having a hard time. And it's okay to seek help when you're having a hard time. And when you come to someone like a counselor, expect to work. You can't just expect them to solve your problem for you. That's not going to happen. That's not what counselors do. And when it comes to addiction, we know that I or someone else didn't cause your addiction. We can't control your addiction and we can't cure your addiction. Well, Desiree, if you can't cure addiction, then why did you become an addiction counselor? Because people still need help working through their own problems. And addiction is a problem. It's not a moral problem, it's a disease. And a lot of people are still stuck on that whole, if you could just go to church more, if you were just a better person, if you just had more willpower, you could stop. That's a lie. But I'm there to help them to figure out some coping skills, to get past those points of craving. Just like people have to have coping skills to get through depression. People have to have coping skills to get through diabetes. People have to have coping skills to get through hypertension and other chronic diseases. And the rate of relapse for addiction is no more or no less than those for other chronic diseases. It is absolutely a disease. So we need to move past this moral model of you could do better if you wanted to. There's been physical changes in the person's body, chemical changes in the person's body. It's no longer how it used to be, and because of that, it is classified as a disease. If you've ever cranked the lawnmower, it primes the lawnmower. You have to push a little button, you have to prime the lawnmower in order to crank it. It gives you just a little bit of that gasoline to crank the lawnmower. And it's the same thing when you do drugs or alcohol. The brain stores that memory in the amygdala that, yeah, that was good. We need that for survival. And so what happens is when you see something that you've associated with your drug or alcohol use, the brain starts to release a little bit of dopamine, a little bit of serotonin, a little bit of norepinephrine, whatever, and it primes you. And that's what gives you that craving. Ooh, I really want that piece of chocolate cake. You don't really want the piece of chocolate cake. You just want the dopamine rush or the serotonin rush that your body gives you when you eat the piece of cake, or when you drink the alcohol, or when you snort the line of Coke, or when you smoke the blunt. You want the dopamine. And there's other ways of getting dopamine and serotonin into your system, or released into your system, because your body makes it naturally, outside of using substances. So because we know that our brain is priming us and it will dissipate within 10 to 15 minutes, we have to have those coping skills to get through those 10 to 15 minutes so that we don't use while we're having that craving. Because that's what the craving is. Your body just releasing a little bit of dopamine and telling you you need more of it. So don't be afraid to go to a counselor for any reason, but let's get rid of the stigma behind counseling and behind addiction. The more you know, and the better it's going to be for everyone.